Medidenta. Suitable endodontics.
In this last segment of the Low Engagement Instrumentation Technique, we are going to show how to perform the technique on straight canals like anterior teeth and lower premolars. Don't forget to take a look on the 3 previous videos, the LAT fundamentals, the LAT narrow and curved canals, and the LAT curved canals. Let's take a look.
The technique will be demonstrated with the Medidenta's M-file gold instruments. These files are composed of a USA Fort Wayne's nickel titanium alloy, with a rhomboid triangular cross-section. The proprietary heat treatment performed leaves the instrument with extra flexibility, predominantly in the martensitic phase. The M-file gold recommended rotation is at 300 revolutions per minute, and torque of 1.5 to 3 newtons per centimeter. The instruments must be sterilized before use, and are for single use only. M-file gold instruments are offered in diameters from 15 to 60 in taper 04, and 15 to 50 in taper 06. The color of the M-file gold rubber stop indicates the taper. The green is 04. The red is 06. We are going to use the same 3D printed endo block used for the curve and narrow canal in the previous videos. In this segment, it will be demonstrated step-by-step instrumentation of curved canal using the distal canal. The distal canal is representing the majority of straight and flat canals anatomy. It is quite straight from mesial to distal, equally from buccal to lingual. Pour RC prime lubricant at the pulp chamber. Place a K file inside the canal and advance to the temporary working length. With the instrument in position, turn on the apex locator, connect the lip clip and file connector. Gently advance apically with oscillatory movements until the apex locator points to position 0. Remove the file connector and proceed with a smooth enlargement, with the file in position, using oscillatory movements. Always finalize with copious irrigation. After determining the working length, use the M-file gold 2504 up to the working length limit. Do not use pecking movements. Do not exceed 10 seconds of instrumentation. After enlargement, proceed with copious irrigation and patency with the same K file. The next instrument in the sequence is the M-file gold 3506. Use brushing movements in a circumferential action. After no more than 10 seconds of instrumentation, proceed with copious irrigation. Finalize with patency. The next instrument in the sequence will depend on the initial anatomical space of the canal. In this case, we will finalize with the M-file gold 4504. Use brushing movements in a circumferential action. After no more than 10 seconds of instrumentation, proceed with copious irrigation. Finalize with patency. The low engagement technique described results in a space suitable for safe gutta-percha master cone insertion until the working length. Thanks for joining us in this video. For more information, go to www.medidenta.com.
Medidenta. Suitable endodontics.